What is mucormycosis, or commonly referred to as the black fungus? Let's find out in this video. Mucormycosis is a fungal infection. What are the signs and symptoms of mucormycosis? Who are more likely to get mucormycosis? And finally, what is the medical and the surgical management, or what is the treatment for mucormycosis? As you all know, there is an increased prevalence of mucormycosis cases in patients who have recovered after the second wave of COVID. Why is it so? Quick disclaimer regarding this video. This video is not medical advice. Please consult with your physician before taking any treatment for any disease. Consider this as just data points regarding mucormycosis. Mucormycosis is just a fungal infection. So, where are the fungal spores found? Fungi is a type of microscopic organism and is found all over the environment and in places where the environment is congenial for its growth. And what are the favorable factors which promote the growth of this fungi? Fungi usually prefer a wet or a moist environment with acidic pH, and also as a source of food supply there has to be a lot of dead and decaying matter, and an unhygienic and an unclean environment is particularly suitable for the fungal spores to develop. If the fungal spores are found all over the environment, why is it that certain patients are getting affected whereas the majority of the patients are not getting affected even if the fungal spores are exposed to the patient? It is because of the lack of proper immune response in that patient, or the immune system is weakened because of comorbid conditions like diabetes mellitus, or people who have had organ transplants or of immunosuppressant drugs. Excessive use of steroids to treat moderate and severe patients of SARS-CoV-2 or COVID-19 infections is also a leading cause for the development of mucormycosis. So let us see about these causes one by one in detail. As you all know, COVID can cause three major manifestations in a patient. It can either be asymptomatic, or in symptomatic patients it can cause a mild form of a COVID disease, or a moderate form of a disease, or a severe form of a disease. Usually about 85% of the people have mild flu-like symptoms, fever, some body pain, and recover after 1 week of exposure and symptoms. But in however, 15% of people affected by COVID, they tend to develop more severe symptoms and signs, and they do require hospitalizations, and out of which 5% may require oxygen support and ICU ventilators. Steroids is a life-saving drug for moderate and severe cases of COVID infections. However, excess use of steroids can reduce the immune system strength and thereby making way for opportunistic infections like mucormycosis and other infections to occur after the recovery from SARS-CoV-2 infection. So why are steroids used in moderate and severe cases of infection? After 1 week of COVID infection, some people, particularly with strong or good immunity, can develop a phenomenon called as cytokine storm. And this cytokine storm is nothing but the immune system gets overactive and tries to be overprotective of the body. And in this way, the immune system, which is initially targeted to destroy the COVID virus, ends up damaging the lung parenchyma. And in order to suppress the cytokine storm, steroids are used. And in this way, the inflammation or the mechanism by which the parenchyma or the tissue of the lung is destroyed is prevented. But the immune system does not only reduce the cytokine storm and also prevent it, but it also reduces the overall immunity of a person who's been administered steroids. So what will over administration or overdose of steroids do? It will reduce the immune power of the human body. And when human body's immune power is reduced, it also provides an opportunity for various other infections like mucormycosis. And it is because of this reason mucormycosis is more prevalent in patients who have used a lot of steroids for the treatment of SARS-CoV-2 or the COVID-19 infections. Because of this reason, steroids have to be used with a lot of caution while treating the infection. What happens in case of diabetes mellitus? In diabetes mellitus, the blood sugar level is higher than how it is for normal people, and because of this glucose serves as a food material for the fungi, and if there is excess availability of glucose, the fungi will use that glucose as a source of food and will develop rapidly. And also, when you use steroids in patients with diabetes mellitus, steroids have a property to increase the blood glucose levels. So, in patients with severe or mild COVID infections and who also have comorbid condition like diabetes mellitus, increased the dose of diabetic drugs must be advised, and it has to be monitored according to the blood glucose level. For patients who have had organ transplants or for cancer patients, immunomodulators or immunosuppressant drugs, simply put, these drugs reduce the immune power of the human body, are used, and because it is used, the immune system is reduced, the power of the immune system is reduced, and because of this reason, opportunistic infections are also more common in this particular group of patients. So what are the places of the human body where this mucormycosis or black fungus infect? It can infect the skin or it can attack the skin, also called as a cutaneous variant. The word cutaneous means skin. So how does it enter the skin? If there is any cut on the skin surface and if you are working in uncontaminated particles and through that cut the fungal spores can enter into the skin and cause an infection there, and if it is going to infect the skin, it can cause fungal growth over that particular area. There could be redness and it is also a lot itchy and you tend to scratch in that area a lot. And the most common place where it affects is the nose, the orbit or the place where the eyes are present, and also the brain. If the mucormycosis or the black fungus infection affects the nose and the brain, it is called as rhinocerebral. Rhino means nose, cerebral means brain. So since it affects these two places, it is called as rhinocerebral. Since the nose is near to the eyes, it can also affect the eyes, also called as orbital variant. It can also affect the digestive tract or also called as the gastrointestinal tract, and the symptoms related are specific to the area or the organ which the mucormycosis affects. If it affects the nose, you could have a lot of running nose and a discharge which is black or brown in color, and it can also involve the sinuses, and the most biggest sinus is the maxillary sinus which is present here, and it can affect one side of the sinus which is called as unilateral. Any disease which affects just one part of the body or one side or one half of the body is called as unilateral. It can affect just one hand or one leg, it is called as unilateral. And in mucormycosis, usually one side of the sinus is affected, and it can also grow through a structure called as the cribriform plate. It is like it has a lot of minute pores through which it can enter into the brain, and that is how it causes brain infections as well. So what are the signs and symptoms of mucormycosis? If it is going to involve the nose, there could be discharge which is black or brown in color. There could be swelling of one side of the face on the side which is affected, and also if it is involving the brain, it could develop a lot of symptoms like fits or seizures and neck rigidity, and sometimes because of the brain involvement it can cause fever as well and a deep headache. If it is going to involve the eyes, it can cause blurring of vision, and in worst cases it can even lead to a loss of eyesight in severe cases. So how do you diagnose mucormycosis? You can take a swab of the discharge from the nose or from the sinus and stain it and look under the microscope, and with that you can come to a diagnosis. And if that is not sufficient, you can do CT scan, you can do an MRI scan and visualize the sinuses and visualize the brain for various changes that are caused by mucormycosis. After COVID infections, the lymphocyte count, which is a part of a WBC, which is part of immunity, this particular lymphocyte cell tends to be a bit less. This can also serve as an indicator after the recovery of COVID patients that this person might be having mucormycosis. So what about the mortality or the death rate of mucormycosis? It depends upon the availability of medical services, the availability of medicine, and also the time of diagnosis when it is diagnosed. If mucormycosis cases are detected and treated early, the mortality tends to be less than 50%. If it is detected and treated at a later stage, and in worst cases, if the brain has been involved and infiltrated, the mortality can be above 95%. It can also be complicated by the presence of other comorbid conditions like diabetes and hypertension. After you have diagnosed the disease, how do you treat the disease? It can be done in two ways. It can be a medical treatment where you use antifungal drugs, or you have to do surgery to remove the fungus. So what is the medical treatment? The drug of choice, or the drug which best can cure mucormycosis, amphotericin B. But amphotericin B can be toxic to the kidneys. The kidneys, what are kidneys? The kidneys are organs which are responsible for excreting all the waste products out of the human body. So renal or kidney function tests must be monitored if amphotericin B is given. In order to prevent kidney damage, a liposomal form or an enhanced form of amphotericin B, where the toxicity or damage causing ability of the drug of amphotericin B to kidney is reduced. Liposomal amphotericin B is an improved version of amphotericin B, and usually if the treatment is started early, then the prognosis or the outcome of the disease tends to be better. If the treatment is started late, the prognosis or the outcome of the disease tends to be bad. In mild cases, 4 weeks of amphotericin B treatment may be required, but in severe cases where the brain is involved, up to 8 to 10 weeks of amphotericin B may be required, and the dosing is given as per the kidney function test results. So what do you do if a patient comes at a later stage where all the sinus cavities are filled with fungi? Then there is no other go but to do a surgery, and not all surgeons can do it. It is a particular branch of surgery called as maxillofacial surgeon who can perform this surgery, where you have to debulk or remove a part of the maxillary sinus along with the fungi material, and this process can be disfiguring to the person. But no other go, this person has to go through this surgery or risk losing their lives because of the brain infections that are highly associated with later stages of the disease. Preventing a disease is far more better than curing the disease in the first place. So what are the various precautionary measures that we can take to prevent the disease? Overcrowding of hospital beds is also an important factor, and adequate spacing can be given between patients. One of the speculations for the cause of mucormycosis in patients who have recovered after being put on ventilators is that sterile water or distilled water is used to humidify oxygen before it is given into the lungs through a ventilator. If this sterile or distilled water has a lot of contaminants, and if it is not changed properly, it can also be a source of fungal infections. So the sterile water used in the ventilators and humidifiers and in other oxygen masks and outlets must be maintained and properly cleaned. As discussed before, people who have comorbid conditions like diabetes or hypertension or any other cause which can cause a decrease in body immunity must also be monitored very carefully. For patients who have diabetes mellitus, the blood sugar level must be controlled, and for patients who are diabetic and who have been given steroids, a physician must monitor the blood glucose level before administering steroids, and a strict control of glucose is maintained. Otherwise, these patients have a highly increased risk, and the incidence of mucormycosis or the occurrence of mucormycosis is much more higher for diabetic patients who have recovered after COVID as compared to people who have no comorbid conditions. Early diagnosis and treatment and quickly administering the necessary treatment will also reduce the mucormycosis load on the healthcare system. Well, that's it for this video. I hope you found this video. If you like this video, please subscribe to our channel and stay tuned for further interesting content in the field of medicine, and I will see you in the next video.